G'day! Welcome to Shooting the Breeze with Lady Liberty. I'm Kate Fantanell, or Lady Liberty. But a few people ask why I call myself Lady Liberty, apart from the fact that I stand for liberty. My Northern Italian last name people seem to mispronounce a lot, so Lady Liberty is what I go by, but you can call me Kate. I am so excited again today because I have the pleasure of having two inspirational guests on my show. But first, a bit of an introduction. So, the topic at the moment seems to be that affects us all health. It's been a really interesting time the last few years when it comes to public health and government's response to health crises. It affects us all. So, I wanted to have a big chat about the state of our healthcare system. We're told that we have the best healthcare system in the world in Australia. We had Medicare turned 40 the other day, and the politicians tweeting about how lucky we are to live in Australia with Medicare. I had an experience with the healthcare system recently in WA that I'm happy to share, and it wasn't that great, but that's where we're at. So, what's the relationship between the state and healthcare and government departments and the machinations of government departments and the effects of decisions on healthcare policy? And who better to talk about that than the people at the front line, the people who see the real world effects of policy instituted by governments and government departments in real life. The ones who see it are the doctors and the nurses. I actually come from a family of doctors and nurses. My grandmother was a nurse. She's still alive. She's 97 in a nursing home. I can't wait to see her this month. My brother is a nurse. I've got aunties who are nurses. I don't know what happened to me. I think I can't stand blood or needles unless it's a tattoo needle. But the doctors are the ones who are at the front line. So I'm so proud and blessed to be joined by two inspirational doctors who have been very outspoken the last few years and put their livelihoods and their profession on the line to talk about some of the things that are going on that just aren't right. They took the oath, do no harm, and their job is basically to keep us alive. So I'd love to welcome to my program Dr. Julian Fidge from Victoria. Hello, Julian. Welcome to the show. I've interviewed you before on Liberty Chat, so it's great to have you back. I know you've got lots to say. And also from WA, where I am, Dr. Joe Kosterich. Hello, welcome to my show.
Pleasure to be with you, Kate.
Thank you. Now, I wanted to get the show started with a topic that it's got my blood boiling, and you've both been tweeting about it. Vapes. What better way to illustrate the state of public health in Australia than talking about how the government is regulating what should be seen as a device to help people quit cigarettes, but that's not what they're doing. Dr. Joe, can I start with you? I know you're going to tell me vaping is bad, cigarettes are bad. Are you going to tell me that? Are they okay for me?
Cigarettes are bad. I'll certainly tell you that. I don't think you need me to tell you that. I think anybody who hasn't been living under the proverbial rock since the early to mid 1960s is aware of that. And look, we've seen declines in smoking rates. I mean, we've seen over the years something from 70% in the 50s and early 60s% of people smoking down to much lower rates today. And there's a number of ways of giving up smoking, and that includes going cold turkey. There are, things like patches and gums and sprays containing nicotine that you can buy at the chemist. There are quit programs. There's hypnosis. There are prescription medications that got some problems, but they do work for some people. The world's most popular and effective stop smoking method is vaping. And that's not me saying that. That is from the Cochrane collaboration, which is the world's largest assessor of medical data and studies. They don't do the studies, they assess them. And the UK government has on 3 occasions affirmed that vaping is at least 95% less harmful than smoking. And we see in countries like the UK and in New Zealand, where they actively promote a switching from cigarettes to vaping, that their smoking rates are falling. In Australia, our rates are not falling. It's around about 13%. It hasn't moved much in the last decade, and that's despite plain packaging and the world's highest per stick cigarette prices. Australia has a completely, and I should point out one more thing, 40% of Indigenous people smoke. And that really, that's 3 times the national average. So we should be doing everything we can to help people stop smoking. So what's the government doing? Making it harder for people to stop smoking. It's easier to buy cigarettes than to get nicotine liquid for vapes. Vaping is at least 95% less harmful than cigarettes. It's not harmless. If you don't smoke, I would never suggest that you take up vaping. Equally, I wouldn't suggest to teenagers that they take up the cocaine or methamphetamine or a whole host of other substances either. But we've got this moral panic in Australia about youth vaping, which, by the way, is a product of failed policy introduced in 2021, which created a thriving black market. And now Mark Butler, the health minister, and for what it's worth, I think the worst health minister that I've seen in my lifetime, has decided that we want to make it harder for people to stop smoking. You can go to the supermarket, you go to the corner shop, you can buy cigarettes, all good. You can go to supermarkets and buy nicotine in patch, gum or spray form. Again, all good, multiple flavours, gigged on specials some weeks. But put that nicotine into a liquid and make it the form that is the most preferred by people who want to give up smoking. Oh, no, we can't do that. And so what we've got now is people who will be going back to smoking. It's going to be harder for people to give up smoking. And just to cap it off, a thriving black market and criminal turf wars. And we're seeing fire bombings, more so in Melbourne, I'm going to say about Melbourne, than any other city. So we're sort of really going to revisit the same themes as prohibition in America in the 1920s. We know how well that ended. And we are completely out of step with the medical evidence and the rest of the world.
I know this was happening under previous Health Minister Greg Hunt. I was working for former Senator David Linehelm, and we had numerous meetings with Greg Hunt as Health Minister, just saying, come on, give us a fair go. Like, why do you have to have this approach to vaping? No other country is going down this path of basically prohibition by stealth. And now they've put the doctors in the position, and nurses I saw as well, who are responsible for prescribing these devices and nicotine vapes. And I'm sure as doctors, you wouldn't want to prescribe cigarettes. So why would you go and prescribe vaping as a next step, unless it is to help someone quit? But you are going to see people who are addicted to these devices who want to come in to get their fix. And then you're put in the position of, well, I don't really necessarily want to get involved in this. And from my point of view, bodily autonomy, it's my vice. I should be able to smoke if I want to. I should be able to vape if I want to. Please stop treating my vice as a crime. That's where I come from on this. But you are the medical expert. So 95% effective rate for stopping smoking. That's incredible. And now it's just made it harder.
Not 95% less harmful than smoking. I'm saying it's 95% effective in people quitting. But it is the world's most effective method.
Yeah. Dr. Julian Fidge, I saw there was a firebombing of a vape store in Ballarat, Victoria. What's going on there? I know there's like gangland wars happening. I've seen Underbelly enough times to know how it works. Why are we seeing this? Why would the government enact a policy that is actually causing more harm, creating more crime? We don't have the resources to police the vape police. What's going on?
I don't know. I certainly don't know anything about the firebombing. In terms of science and medicine, it seems to be distorted by the taxation. So Australia has the most damaging form of taxation of cigarettes, of tobacco in the world. So in Australia, we're taxed by weight of tobacco, and that means the manufacturers put very little tobacco in the cigarettes and lots of rubbish. So everywhere else in the world, it's taxed per stick. So Australian cigarettes, the cigarettes manufactured here are made up from floor sweepings and very little tobacco. And if you go overseas, you can buy much, much cheaper cigarettes, which are much better quality, and they're far cheaper because they actually have tobacco, the correct stuff in them. The the dependence of the Australian government on tobacco tax has really distorted this whole argument. So if it was just about health, then we could have just done what New Zealand has recently done. We could have said nobody born after 2010 can ever buy cigarettes ever, and that's the end of it. So if you're 13 now, and anyone who was born after 14 now, if you're born after 2010, that's it. They will just never be available to you. But instead, they want to keep their taxation revenue. They're messing around with alternatives like vaping, which appears to be better, but vaping hasn't been around for long enough to really assess. So hopefully it's better, and hopefully people will switch to vaping, but vaping still has problems.
Yeah, I'm just going to jump in on a couple of points. Number one, that move in New Zealand from the previous government has been revoked by the new one. And look, to be honest, banning people from buying cigarettes is not the answer. What you want to do in an ideal world is make it that people either have other options or that they don't want to smoke cigarettes. And to your point about bodily autonomy, Kate, I mean, if you ask my opinion, should you smoke, I'm going to tell you no. But at the end of the day, is it my role or the government's role to come around to your house and take away your packet? I think the answer to that one is also no. Vaping's been around for over 20 years, and there has been work done that I really want to emphasise is not harmless, and if you don't smoke, don't take it up, but is at least 95% less harmful. And for the very simple reason that you actually touched on, Julian, is there are far, 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 far fewer chemicals and non-carcinogenic chemicals. So you heat up the liquid, it brings the nicotine in, it's got a carrier liquid, but just on that basis alone, it hasn't got the formaldehyde, it hasn't got a whole lot of other, carcinogens, which again, people shouldn't do unless, if they're not currently smoking. But that you now need a prescription, and as you said, Kate, a prescription, you got to go to the doctor. You don't need a prescription for cigarettes. You don't need a prescription for nicotine in these other forms that you buy at the supermarket. And the government's been telling doctors, vaping is bad, vaping is bad, and now said, it's up to you to prescribe it. Now there are doctors out there who do prescribe it, and there are some online clinics. But what most people will be doing, and the laws you mentioned about Hunt in 2021 introducing policies which effectively made a prescription a requirement, but it's estimated that 95+% of people who vape haven't. They've just gone through the black market or imported online, and that is going to continue. And Butler tweeted out a picture of him standing behind in front of some contraband. And, look at what we've done. It's pathetic. It's absolutely pathetic. It's like every time they have a drug bust, it's like, we stopped the drug trade. No, you haven't. Maybe you've intercepted a few packages, but that's about the extent of it. And the black market is just thriving. And the black market has no quality control. So it's far more dangerous than having the New Zealand model, which is a legalised, regulated system with quality control. You don't sell it to minors. You don't advertise it. There's a whole lot of mechanisms that can be put in place that I suppose we apply, for example, to the alcohol trade. We do not have to reinvent the wheel. We just have to drop our arrogance that says we know better than the whole of the rest of the world combined, and we don't.
It's funny you mentioned that picture of Mark Butler standing in front of all those seized vapes. I was listening to ABC Radio before and they were saying how great it is. But when I worked for the Sporting Shooters Association of Australia, I did a bit of a story on in relation to gun seize, because they love seizing illegal firearms. And in reality, they only inspect about 1 in every 200 things that come into Australia. But I found out they were counting individual bullets as guns. So they made some outlandish claim about seizing all these firearms, and then you went back through the data and they were counting magazines, individual bullets as actual firearms, and putting out these stories saying, look how great our customs are. So sometimes you have to dig a little bit deeper, but that picture of the health minister in front of these items that could actually help people. My brother-in-law and sister are smokers and they switched to vaping to quit. And now guess what? They're gone back to cigarettes because they don't want to get in that hamster wheel of going to the doctor, getting a script, and all the money. People don't have money lying around for that. So it's another example of government creating a problem which at the end of the day, the individual suffers, the health of the people suffer. And that's another thing I wanted to talk to you both about, is how people have suffered over the last few years with how governments handled the pandemic. Now, Dr. Joe, I know you've been very outspoken about this, and you've lived in Western Australia like I have since the pandemic. I moved here in February 2020 and got stuck because they closed the border in March, and then all of a sudden I'm here 4 years later. But that time, I feel there has been a loss of faith in public health because of how governments handled it. What do you guys think as doctors? I'll start with you, Dr. Joe, because you were in WA and we had mandates for 3 injections covering 75% of the workforce. And now we're seeing some interesting data. Rebecca Barnett, a journalist who's based here, is doing some really great work analysing it. But what's your perspective as a doctor? Firstly, how they approached this whole thing.
Where does one say? It's difficult to conceive of it having been gotten more wrong. And, basically COVID was always a cold. And the original projections from Neil Ferguson and his group in England were just way, 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 way over the top. John P. Ioannidis, who's probably one of the world's foremost epidemiologists out of Stanford, wrote early on in the piece, I think it was in April 2020, that this virus, aside from the elderly who are at more risk of flu and of any virus, is just not that serious. It's no worse than the flu, and possibly milder. And that's exactly how it turned out to be. And each subsequent mutation became milder because that is what viruses do, and we know that. So to lock down healthy people, to lock children out of schools, and all of this is supposedly to keep granny alive, was never part of any pandemic plan. There was no evidence to support it, and yet we did it. And WA is an interesting international example because the caseload of COVID infections and indeed deaths, either with, probably more with than from, caught up to the rest of the world just 2 years later, because ultimately the vaccines didn't stop people getting or transmitting the virus. So when we had restrictions on people, you couldn't go and get a cup of coffee unless you'd had the vaccine because you're a threat to the greater good. You weren't, because it didn't stop transmission. So what's the point? If it's not stopping you passing it on, then does it matter if you've had it or not? And by the way, if it doesn't actually stop you getting it, then what is the point? And look, it possibly, although even this is a question mark, but it may well reduce severe illness in those who are vulnerable, and certainly for those who would want to have a vaccine, then they absolutely should be doing so. But to force it on people, and even more so given that it was from start to finish around about 12 months. Normally it takes 8 to 10 years to bring a vaccine to the market. Look, we can all be a genius with hindsight, except people like Ioannidis, Jay Bhattacharya, Peter McCullough, the people who wrote the Great Barrington Declaration, they were completely 100% correct in saying focused protection, let everybody else get on with their lives. And by the way, did anybody actually ask this fabled granny whether she actually wants to die alone and not be able to see her grandchildren? Nobody, as far as I'm aware, nobody actually asked these people. So hopefully, not super confident, but you never know, some lessons have been learned, and we will never see this sort of behaviour again.
You mentioned Dr. Jay Bhattacharya. I've actually met him when I was in Melbourne, Victoria, working on the campaign, the state election campaign, and he advised Florida's Governor Ron DeSantis, and he was saying especially about the mask mandates and how the masks, they weren't, unless you had the proper N95 properly fixed, these masks that they made us walk around in were doing nothing to prevent any kind of transmission, and what it did to the children as well. Like we're seeing speech impediments, self-esteem issues when they closed the schools, the effects of that. So it was interesting to see his perspective, and that's why Florida did so well in terms of civil liberties and letting people get on with their lives and make their own choices about the risk. Also at the start of the pandemic, I heard the libertarian argument for vaccines, not for vaccine mandates, just for vaccines, is if you embrace the principle of do what you want as long as you're not hurting anyone else, and a way that you can prevent hurting someone is getting a vaccine that prevents transmission, then if you're a libertarian, you should go and get it. And I thought, okay, that's great. But since then, it's come out that the data shows that these vaccines were not as efficient as we were led to believe and told they were by governments and Big Pharma. Dr. Fidge, you were in Victoria, so you had a different experience. You still had mandates as well. What did you think about the Victorian government's approach to the pandemic, not just in relation to vaccines, but overall? I mean, Melbourne, the most locked down city in the world, it's terrible what happened there.
I'm embarrassed to be a doctor in Australia, and I'm ashamed. The hysteria of my colleagues was just pitiable. It was pathetic that they could go through this really robust education and training, and then just turn into headless chooks. It was embarrassing. I cannot believe that they were so lacking in character, such cowards, and so thoughtless in everything that they did, from the chief health officer, the federal, state, down to my GP colleagues. I wrote an application to the TGA about ivermectin and why the Schedule D listing of ivermectin should be removed. And one of my colleagues said that I needed to be referred to APRA for doing that. And it's just like, what the hell is the matter with you people? Are you also hopelessly ignorant that you don't know anything about ivermectin? I appreciate that I'm also a pharmacist, and I have a greater working knowledge of medications than my colleagues. I appreciate that I've worked in Africa a few times, and I have an interest in the medicine in second and third world countries. But to actually be suggested that I was doing something illegal for making an application to the TGA, and that I needed to be disciplined by my professional body for making a perfectly legitimate application under the TGA Act to the TGA, is just embarrassing. And there's no other word for it. I mean, these people were embarrassingly ignorant. So I've been ashamed to be a doctor in Australia recently, and Victoria was one of the worst places in the world for this. I wrote to the Premier and Cabinet on a couple of occasions directly, and I explained that I'm a general practitioner, and a rural general practitioner. I have a busy practice. I understand what's going on in the rural area that I'm in. I'm also a pharmacy owner, and I have a strong working knowledge of the health of the region where my practices are. And the idea of having lockdowns in the country in rural areas where there was no virus was counterproductive, because when it was actually required, then people would no longer have any respect for them, because the government had just cried wolf for too often and for too long. And I didn't even get a reply from the Premier and Cabinet from the emails that I sent. It was so for someone like me who's got a Bachelor of Pharmacy, a Bachelor of Medicine, graduate diploma of Applied Science in Computer Science, my fellowship, I've got a Masters of Medicine in Pain Management. I've always been active and interested in medical therapies. It was you're just treated with contempt by these people who have little to no education, and it was mind blowing. And then after I made a comment about the mandates, APRA and the medical board decided that they would prosecute me for saying, and I think it was I said that it's strange that you need a mandate for a vaccine that is so safe. And they've accused me of being anti-vaccination, and I've never been anti-vaccine. Uh, Shortly before I went to the Rwandan emergency in 1994, I received 9 vaccines in one setting. I had 4 injections in one arm, 4 injections in the other, an oral Sabine, and I had no problems at all. And I've had every vaccine that comes along. And I had to have the COVID vaccines as well. And I'm definitely not anti-vaccine, but they prosecuted me for it. And the tribunal, when I appealed to the tribunal set aside most of APRA's, the medical board's decision. But they cautioned me that when commenting or posting on social media, where my professional status can be identified, I have to take care to avoid conveying a message that can be construed by the public as contrary to established public health programs. So, as well as being embarrassed and ashamed, I'm now very angry. These people are neo-Nazis. They are telling me that I have to agree with the government, and if I don't, I will be punished. Do you mind if I share my screen with you for a moment?
I think you can. Yeah, give it a go.
The this
I don't know if I've got share screen on this.
you'll soon
Oh,
see.
there we go. Yep.
We'll find out. Oh, there we go.
There it is.
So I haven't accepted that the tribunal, or actually anyone in Australia, can tell me that I have to support the government about anything. And I've appealed this to the Supreme Court of Victoria, and that case will be heard later this year. But you can see on the second page at the top there, where it's the order subject to appeal. That's what the tribunal said, that I'm not allowed to make comments or post anything that could be construed by the public as contrary to established public health programs. These people are insane. You know, that what do they think that they have a monopoly on wisdom or knowledge or correctness? And do they think that I know nothing and that I shouldn't criticize them? I mean, these are the people who did robo-debt. You know, they act unlawfully and harmfully, and people committed suicide because of the government program. And the only reason that these things get scrutinised and overturned is because people ask questions and criticise and point out the flaws. It's just this is very worrying. This sort of totalitarian, authoritarian orders by a tribunal in Australia, where they're telling me I can't disagree with the government. And I'm looking forward to this hearing. I don't have a lot of confidence in the Supreme Court of Victoria. I think that they're a fairly obsequious puppet of the Victorian government, but I'm looking forward to finding out why they think that they can tell me I have to support the government. It's crazy.
And there's a couple of very key issues in what you said there, Julian. I mean, the term second opinion is often said. A patient comes to see a doctor and they can go and get a second opinion, because it's exactly that. It's an opinion. And, doctors, a bit like lawyers, you ask 3 and you get 5 different ones. So in private medical practice, anybody who comes to see me or yourself, Julian, any doctor, can, number one, seek another opinion, and that's something that's often very good to do. Number 2, is required to be given informed consent about anything. They can't be forced. There are a couple of exceptions when capacity is in question, but other than that, cannot be forced to undergo any medical treatment or procedure. And number 3, get access. If somebody wants to access their medical files under freedom of information, they can do that. Now, if I become a public health doctor, all of a sudden, nobody can have another opinion. Nobody can ask any questions. And the fabled health advice, and you'll be obviously familiar with this in WA, Kate, the fabled health advice, nobody's ever allowed to see it. If you're a patient in a private practice, even in a public hospital, you can say, I want to see the advice that I've been given and the basis for it. But because it was given by a basically a bureaucrat who happens to have a medical degree, but they're a bureaucrat, number one, no second opinion. Number two, illegal to question because somehow they could not possibly be wrong. And number three, no access to the basis of the recommendations being made. So that is completely at variance with standard medical practice. So yeah, major issues there. And history has also shown that when the medical profession becomes a tool of the state, typically doesn't end very well for the populace. People need to be able to be confident that the doctor that they talk to and see has their interests at heart and is considering their individual circumstances. Like penicillin's a great drug, but you know what? If you're allergic to penicillin and I prescribe it for you, you could die as a consequence of an anaphylactic reaction. It doesn't matter that penicillin's a good drug. It's not suitable for everybody. And this sort of ad hominem about anti-vax is a bit like saying, well, if I won't prescribe thalidomide, I must be anti-tablet. Well, no. Some medications are very, very useful and can and should be prescribed and are prescribed. But that doesn't mean that just because it's a tablet it's good. It also doesn't say that, every vaccine, just because it is a vaccine, is of equal usefulness. So that this concept that because you may have a problem with one particular form means you're against the whole concept, just sort of shows that people really have fairly weak arguments.
It's interesting you brought up the public health advice. And I know during our lockdown in WA and other lockdowns in Victoria, we were asking to see the health advice. Show us why the border is still closed and controlled 2.5 years later. Show us why someone can travel into Western Australia internationally with only 2 injections, but if I want to travel domestically, I need 3. Show us the health advice for locking us in our homes and putting in curfews. They didn't want to show us that. That's another reason why I think faith in public health has been lost and eroded so far over the last few years. I don't know if it will ever come back. And talking of losing faith in the health system, can we talk for a moment, Dr. Joe? You would know this story very well, and Dr. Julian Fidge will share this with you about Aishwarya. She was a young child who was taken to the Perth Children's Hospital. She was not doing very well at all, and during her time in the waiting room, of which she spent 90 minutes, and it turned out she had sepsis, by the time she was eventually seen, she passed away. It was too late to save her. And this was when the health minister at the time was the now premier of our great state, Roger Cook. So he was also the one who was in charge of the health department during COVID and was part of the conglomerate, I suppose, that made us have 3 injections to keep our jobs. I don't really know what's happened to our chief health officer. I feel like he was a bit of a puppet, but they're not gods, by the way. I know in South Australia, where my family is, they kind of worship Nicholas Spurrier, who was famously the one who said, if the football comes into the crowd during a footy game, don't touch it because you might get COVID. She was a paediatrician, a children's doctor, but ended up being the one in charge overseeing the pandemic. So we'll leave it there. But this is my question to you 2 doctors who have worked in hospitals, and we'll get to your story about Queensland Hospital in a minute. What do you see when a child in Australia in 2021, we'd had the border closed since 2020 under the guise of preparing the hospital systems. So we didn't have very much travel into our state, and still a child went into hospital in Australia and ended up passing away because of lack of care. Yet these politicians scream that we have the best healthcare in the world. As doctors, how do you feel after taking the oath to basically keep us alive and then seeing that happen? Is that because of governments running healthcare? Should governments be in charge of looking after such an important section of our lives? What can we do to prevent this happening ever again? Dr. Joe, you know the story I'm talking about?
Look, the first thing to say, and I think this is really important, is that good outcomes can never be guaranteed in any situation or any circumstances. So whether or not Aishwarya had been seen 30 or 60 minutes earlier, we can't necessarily say that if they'd have started antibiotics earlier because she had sepsis, that would have made a difference. It might have, but I think that's an important point, that you can, and look, to be honest, notwithstanding everything we've said, I'm yet to be in a country in the world where I'd rather get sick than in Australia. That's not saying we've got a fantastic system. Everywhere's got its problems, but I'm yet to see that there's a place that's head and shoulders above us. Maybe some of the Scandinavian countries push above their weight, but whether it's comparable. So you cannot have perfect outcomes for everybody in all circumstances. You can look to minimise the likelihood of preventable deaths and preventable complications. You can minimise that. There's just too much bureaucracy, and you find that doctors and nurses in hospitals and in private practice as well are spending more time on paperwork, box ticking, filling out forms than actually seeing and treating patients. So perhaps if some of the nurses in that emergency department had been able to do less paperwork and spent more time assessing patients, I'm not going to say the outcome would be different, because nobody can say that. It's possible, but at least you would have been seen sooner. Look, I think it was Milton Friedman who said, putting the government in charge of the Sahara Desert, there'd be a shortage of sand within sort of, 5 years. Certainly putting the government in charge of health is just not the way to go. There is a role for government in health. I'm not going to pretend there isn't a role, but like most issues, it's how big or small that role is. And it seems to get bigger and bigger. And the number of bureaucrats in the health system, I suppose it's similar in education as well, grows exponentially. And they scream, oh, we've got enough money, we haven't got enough money, we'll get rid of half the bureaucrats who aren't doing anything more productive, and suddenly you might have a bit of money to devote to frontline services. So that really is the problem. You go to a hospital on a weekday versus a weekend, when you've still got most medical and all the wards are staffed. They've got nurses on board, but the car park will be 4/5 or more empty, which says that essentially all the admin people aren't there. And again, you've got the federal and state health departments that have huge and growing numbers of bureaucrats who really, if they disappeared tomorrow, I don't know if anybody would notice the difference, except they would, because they're not getting a paycheck, but I don't know if anybody else would notice the difference.
Yeah. Dr. Julian Fidge, do you have any comments to make on that kind of systematic failure that resulted in a child dying in a public hospital in 2021?
Yeah, look, I agree with everything that Joe has said, but clearly there was, and it happens very often, that there is a failure of senior supervision. So the consultants are not present in the department, and they're not there looking. So this is one of the cardinal things that doctors are taught, is how to spot a sick child. So I couldn't go out and start my GP training until I'd done my pediatric rotation, because it is essential, it is critical that a doctor can spot a sick child and take swift action, because they're so vulnerable. But what happens is, for the reasons that Joe has outlined, but also because the emergency contracts for the fellows are very generous, and they don't have a lot of actual on-floor time. So if you're a FACM, if you're a fellow of the Australian College of Emergency Medicine, and you're working in a big emergency department, you might spend 3 days out of 5 actually working, and 1 day teaching and 1 day in your study. And so they're only there for 60% of the time. And then when you're there, you have to have a systematic approach to the department. You have to be walking around and around and around, and it's not actually that complicated. You go to the cubicle or the waiting room, or you either with a doctor or a nurse, and you say, okay, what have you got? What have you found out? What's your plan? And you keep everything moving. And it's one of the ways that you can keep the department throughput moving as well, and avoiding this ambulance ramping and bed block. But the consultants just do not seem to be present in the department. So you can have a child turn up, sit in the waiting room, and be literally dying in the waiting room, but the consultants are not aware of it. They're not out there. They're not actively looking at the patients. They're not active enough in their departments, and it's a very common fault in many of the emergency departments. And I've worked in emergency departments all around the world, and the only way you can fix it is you actually have to be out there. You have to be actually out there looking at the patients and being alert to the idea that a junior doctor has missed something. So, for example, when we did handovers at the Alfred Hospital, the junior doctors had to hand over to senior doctors, and the senior doctors had to hand over to junior doctors. So everybody was seen by a senior doctor. It can be that simple. And then I've worked in other hospitals in Australia where it's just the interns hand over to other interns, the registrars hand over to registrars, because it's thought that, well, that's the level of the patient. But there's no science, no research, nothing underpinning it. It's so sad when these sorts of things happen, that a family takes their child to the emergency department and says, look, my child is very sick, please can you help us? And they say, just go and sit in the waiting room. That's terrible. And I can't believe that it still happens.
Well, now in every public hospital in Perth, there's a sign that says, it's called Aishwarya's cool code. So if you start to deteriorate, go up and bang your fist on that table and say, my child's getting sicker or I'm getting sicker. It's putting the responsibility a little bit back on the person, even though the dad, I see his face, the tears streaming down his face is burnt into my brain, maybe because I have such a good relationship with my dad. I can't imagine going to hospital and not going home with your daughter, like as a father. So now there's a code call, Aishwarya's code call, for when to hopefully prevent this from happening again. But do you want to say something, Dr. Julian?
There shouldn't have to be a code call to get reviewed or to be observed by a senior. A senior should be present in the department, and they should have their eyes on everything. And if they can't do that, then they should just get out of the job. It's not that hard. You just walk around and you look at the patients in the department and in the waiting room. It's not that difficult. You just have to be interested and aware. The patients can't be expected to know how sick they are or how sick their child is. They can have an idea, but it shouldn't take a parent taking on the role of basically a doctor or a nurse and saying, no, I need a consult now. The consult should be there in the emergency room as a matter of course, and it's not that difficult.
Well, that gets to the systemic issue. And I think it really is important. And look, I at times get asked to give opinions, in fact, quite frequently, in medico-legal cases where obviously things haven't gone according to plan. And look, you can be the most experienced, you can be the best doctor, have the greatest knowledge, but you know what? We're still human beings, and nobody is going to get it right 100% of the time. It's just not humanly possible. But there's a systemic issue. And to your point, Julian, if there are too many people in the waiting room and not enough staff, then there's only so much that even the most senior doctor can do in trying to look at, there's only so many people they can look at per unit's time. And that is the systemic issue that comes from having too many bureaucrats and not enough doctors and nurses. And you touched on ambulance ramping. Prior to the WA, prior to the 2017 state election, Roger Cook, and our Premier, was complaining that there was, I think, 1,000 hours a month of ambulance ramping, and that was the end of the world as we knew it. I think the most recent figures are in excess of 4,000 hours per month. And I don't think ambulance ramping is the best indicator of how the health system's going, because it's influenced by so many factors. But if that's the one that you wanted to beat your the previous government over the head with, it's now 4 times as great, and it's probably more than that now on your watch. Well, how's it all going, sunshine?
Now, we are talking about systemic issues with health. Dr. Julian Fidge tweeted yesterday, or X, I don't know what to call it anymore. I'm going back to the boomer days calling it Twitter, about Janette Young in Queensland Health at Princess Alexandra Hospital in 2001-2002, about the hospital being rebuilt. Can you tell us a bit more about that story? Because I feel like this is another example of how state has got health so wrong, and the people on the ground that suffer are us, and it's resulted in another preventable death. Do you want to just give us an overview? And Dr. Joe, I'd love to hear your thoughts on this.
Sure. So I actually studied medicine at the University of Queensland, and it was very, very good. I felt well prepared to be an intern, and I started as an intern at the Princess Alexandra Hospital in 2001. So that was in the old building, and they started to build the new building while I was there. And I remember that we went over to look at our new premises as we were getting ready to transition to the new building. And I was amazed that the project was so badly handled. This enormous $500 million project, which was a lot of money back then, that they had forgotten the medical records department, and nobody had sort of twigged that they were missing the largest department in the hospital. And so they had to take half of the underground car park and build a medical records department. So that was half of the underground car park gone. And the other thing they didn't have was a blood bank. So it was designed to have a 24-bed ICU, and the blood bank said, okay, we need to go and check out our new premises. And they said, who are you? And they said, well, we're the blood bank. And we're a very important department in the hospital, and we sit up near the surgical suite and ICU. And they said, we've never heard of you. And this was the level of incompetence of Queensland Health. And so they had to take one side of ICU out, and the 24-bed ICU became a 16-bed ICU. And they built the blood bank in between ICU and the surgical suite. And the reason I wrote that tweet was because Janette Young was a senior doctor at the Princess Alexandra, and she was one of the doctors that I interacted with. And these were not good interactions. So I started my career as a soldier. I went into the regular army as soon as I turned 18, and my parents were a little bit disappointed, but they encouraged me to come back home and finish high school and go to university when I exercised my independence. And I did that, and I became a pharmacist, and I was a pharmacist for 10 years, and then I studied medicine. So by the time I became an intern, I was in my 30s. And I was astounded at how difficult this was for some of the doctors. But one of the things about the work roster there was a single intern for most of the hospital overnight. So this is a 600-bed hospital. It's a tertiary hospital. The people are quite sick. And when you're an intern, you're running around all night, and there's obviously, as a single doctor, you just don't have, you can't attend to all the patients. There's another more senior doctor on call but they just look after transplant and a couple of the specialised units. So you're responsible for the majority of the patients. And I did my on-call, and I was surprised and flabbergasted that they expected junior doctors to do this. And I couldn't not do anything. And I wrote to the heads of departments and I said, look, I've just done my my on-call rotation for overnight, and I don't think that it's safe, because you can't expect an intern to function at this level. They don't have the experience. They can't make the decisions quickly enough, and they don't have the dexterity to do the manual things that they need to do, whether it's taking blood or some other administering injections, whatever. They're just not quick enough, and they don't know enough. And I was quickly punished for making this observation. I finished my emergency rotation, and I was called into a meeting with the consultants in the emergency department, and they said, "Look, you've failed your emergency term." I said, "Oh, that's very disappointing. What was the problem?" And the head of the emergency department said, "Well, you don't know what you don't know." And I just burst out laughing. At this stage, I was older than most of these people. I'd already been a healthcare professional for 13, 14, 15 years. I'd been a soldier. I'd been stood over by professionals in the army as a soldier. And I said, well, of course that's true. Nobody knows what they don't know. But what's the problem? What have I done that I've failed my emergency term? And they wouldn't tell me. These people were psychopaths. They would have quite happily let me go and do something, whatever it was that I was doing wrong, and continue doing it. And if it was unsafe for patients, I would have walked out of that room and just continued doing what I was doing. As it turned out, I hadn't actually done anything, and they were just nuts. And I was being punished for questioning their treatment of their management of the hospital. So the second year came around, and so I had to do they told me I had to do my emergency term at the Princess Alexandra Hospital, and I said, get stuffed. I'm not going to come and work for you if you can't even tell me what I've done wrong. I'll just do the same thing again. You people are bad. And I went to the Royal Brisbane and I did my emergency term, and I passed. And that was different there. There were two doctors on, but they shared the work, and you were on with a more senior doctor, and it was so much more pleasant and achievable. But what the crunch came in 2002 when, over Easter, when this poor lady was admitted to Princess Alexandra Hospital, to one of the medical wards, and she fell out of bed and she got entangled in her bed sheets, and she had a spiral fracture of her femur. And the nurses were very good. They immediately suspected what had happened, and they called ward call, this overnight intern. And this poor bugger got called at midnight, and he didn't get there until 6 a.m. because he was so busy with even more urgent jobs. And he got there down to the ward, and he was immediately called away to another chest pain or something even more urgent. And so this poor lady didn't get seen. So on Saturday, Easter Saturday, I was in seeing my team's patients, and I made my way down to that ward, and I got there in the afternoon. And the nurses were frantic by then because they couldn't get a doctor to see this patient. The team was not coming in. They'd come in on the Friday, and they were going to come in on Easter Sunday. There was no... And anyway, there was no one else available, and then they came to me, and then I was very buoyed that they felt able to come and see me and say, look, Julian, can you please see this patient? I know that she's nothing to do with you. I know that you're not on call, but we haven't been able to get anybody to see her. And I saw her, and I saw the problem, and we did the x-rays. She had this spiral fracture of the femur. I called the orthopedic registrar, and they took over care. She went to surgery, and she died. And and as Joe was saying, you know, we'll never know what the cause was. What it was a fat embolism. We'll never know whether it was from the surgery or whether it was from being left in a tertiary hospital with this having a broken femur, which was not properly secured. You know, so that you've got problems like the sharp ends of the bone opening up blood vessels and fat embolism. And so I called the police. This was just terrible that this poor lady had to lie there in a tertiary hospital after I had taken the trouble and the risk to myself, you know, to write to the department heads, and they had behaved so appallingly, and I felt quite justified in calling police, and the police came, and obviously this was a reportable death because it happened in the hospital, and I don't know what happened from the police report, but Janette Young was a senior doctor at the Princess Alexandra Hospital, and I just throw my hands up in the air like I just did in disgust and dismay and disappointment that these people keep getting promoted, and the good people, because they're not following the narrative, get punished.
It's interesting what you said about early 2000s and questioning those who cannot be questioned. You get punished for it, and 20 years later on through COVID, we find exactly the same thing, that if you want to question a bureaucrat who happens to have a medical degree, then, off you go. Look, unfortunately, medicine is littered with these sorts of issues. You go back to the 1800s, and I'm not sure I've got the pronunciation exactly correct, but Ignaz Semmelweis, who worked out that it was a good idea for doctors to wash their hands after they left the mortuary before they delivered babies, was absolutely castigated and sort of, not crucified, but anyway, hounded out of medicine, ended his days in a psychiatric asylum, and 20 years later they thought, oh yeah, actually washing your hands before you deliver babies, particularly after you've been to the morgue, it's probably not it's actually quite a good idea, we'll do that. But he questioned the conventional wisdom and was, treated about as well as people like J. Bhattacharya and others have been, in the modern era. So medicine claims that it's very, very scientific, but in actual fact, it is much more eminent than evidence-based. If somebody's got enough letters after their name, then doctors are supposed to nod their head and you can't question them. That's not actually scientific. That is an authoritarian system. But equally, you get through med school by passing exams, and there's a lot of them. You then get through postgrad by sort of nodding your head to the right people. If you buck the system, you won't get to positions, and you won't get a postgrad position, and there goes your career. So there's a lot of incentives for people to do that, and not making excuses, but when you look at that, you can actually understand why very, very few want to buck the system. Your story about the hospital reminds me of that episode of Yes Minister, where they have this hospital and it's all bright and shiny new, and they've got 500 bureaucrats, but no doctors, no nurses, and no patients. And according to the bureaucracy, this was a fantastic hospital. So again, we just, really life imitates art.
I watch Yes Minister when I go home with my dad. It's one of our favorite shows to watch. It's very, very funny when it's very, very true. So why do you both speak out? Why? I had Dr. Irene Mavrakakis from America on my show last week, and she has been very vocal against the COVID vaccine. She said it should never have been administered into any human. She's a libertarian, and was against the mandates, including the mask mandates, the lockdown mandates, and the vaccination mandates. So she's been vocal in speaking out. And both of you are doctors and are speaking out, even though it's at great risk to your own careers and professions and livelihoods. So Dr. Fidge, what made you write that tweet? Are you scared that you seem to be making a lot of noise against these people? I know you've also written, I think, to the TGA as well, and you're just vocal against how the medical industrial complex is being run. So what made you speak out?
I do it for my mental health as well as for the ethical and moral imperatives. So the if if you know that something is wrong, then morally and ethically you're obliged to try to right that wrong. And if you don't, then you suffer mentally and emotionally. I'm very lucky. I've had a really comprehensive education about the things that we use to treat patients. My background as a pharmacist and as a medical practitioner places me in a very strong position to make assessments about things like the COVID, the mRNA vaccines, and uh, to to recognise that how rushed they were, because I've been following the approvals process of of medicines for decades, for 40 years. I once considered applying to be the head of the TGA on the strength of my dual qualifications in pharmacy and medicine. But I would never survive in that sort of bureaucratic setting. I hate meetings. So I do it for my mental health, and I do it because I feel obliged to ethically and morally, so I can sleep at night and I can look people in the eye. And the distorted behaviour that you see from public officials when they're doing things which are obviously irrational and they're emotionally not quite right. That's because they're wrong, and they know they're wrong. They know there's no evidence for what they're doing, and they at some level they are distressed. So I'm very happy and relaxed and calm to back my judgment based on my education and training and experience, and I wouldn't be able to look my children in the eye if I let those things go.
Dr. Joe?
Look, very similar to as Julian expressed. If there's such a thing as the right thing to do, then in my view, you need to do it. I mean, you can't fix all the world's ills, and I'm certainly not saying that because I express an opinion that automatically makes me right either. But certainly to me, yes, there's a moral and ethical obligation if you're in a profession and you see that which you don't believe is correct, to highlight it. And if other people come along and say, well, no, this is why we believe it's correct, and here's all this information you're not aware of, then I'm very happy to have my, change my mind. But as soon as you tell me this cannot be questioned, that is a red flag to me. We have to be able to be questioning. That's how humans advance. If we didn't ask questions, we'd still be in caves. So as soon as you say you cannot be questioning of this, there is a serious problem. And ultimately, it's a profession that goes back, to Hippocrates? I don't know, 4,000 years or however many thousand. Don't quote me on the exact number. And those of us who are in practice, we're just the custodians. We have to be able to pass to the next generation and subsequently the fact that there are people in the world who will, to the best of their ability, you do the best of your ability, assist people who are unwell and want help with their health. And if that gets sacrificed to political expediency and the will of bureaucrats, then, we have failed to continue a tradition that goes back thousands of years. So look, I'm not saying this to be grandiose, but, ultimately it's just, you reach a point where you think you need to do what you believe is right. And in this modern world, I suppose speaking out as to the extent that one can is, doing that.
Well, I started my show with a bit of a rant about loss of faith in public health and giving doctors a bit of a spray, but I think I've answered my own question. How do we restore faith? Not in public health, because I'm not quite sold on the state's involvement in the healthcare system. That's also because of my anti-authoritarian streak. But I think it's because of people like you, doctors like you, who are out there questioning the government narrative, questioning the approved science that is giving us faith again. So a big thank you to the both of you. That's why I had Dr. Irene Mavrakakis on my show last week, because without your voices, we would all be tuning into those daily updates. The daily case numbers would still be controlled by what they want us to believe instead of questioning. So from the bottom of my heart, thank you for restoring my faith in some doctors and some healthcare. And please keep doing what you're doing. If you ever want to come on my show again, you're more than welcome to. We've come up to just over the hour now. Dr. Fidge, I just have to ask you quickly, are you going to run ever again for politics? You were a fantastic candidate at the Victorian state election and for the federal election too, I believe. Do you have any inclinations that you'll go back into politics, or
Yeah, I love getting on the hustings and putting forward my ideas for my region in country Victoria, and it's so nice to be able to have a voice, and it works. I got the Daniel Andrews government to spend more than $50 million on regional drug and alcohol rehabilitation just by putting up the policy. It was a really good policy, and they Andrews and the Conservatives both adopted it at the election. Andrews got elected, and they went ahead and built 3 regional alcohol and drug rehabilitation services, and they spent more than $50 million. So democracy can work in Australia. If you have good policies, you can get them up, even without getting elected.
Yes, even without getting elected. Dr. Joe, we'll ever see you run. We've got WA state election coming up. There's all this movement now. Basil's out there putting his foot in his mouth already. Would you ever run for office?
No, absolutely not.
It's a very quick
I seriously, I've been asked on a number of occasions, and no, it's not. That's not for me. I'm happy to have input and various times offered ideas and policy to people who do want to do it, like horses for courses. So we need people in there, and I'm quite happy to assist from my position.
Excellent. I don't think I'll be running again either, but I'll always be outspoken and I'll support those who support liberty. So come up to the end of the hour. Thank you both for gracing me with your presence on this Friday afternoon. I'm going to get outside and head to the beach. It's another hot day here in Western Australia. Dr. Julian Fidge, have a great evening in Victoria with your family and your kids. Dr. Joe, we have to catch up. We live in the same city. We need to go for a drink and a smoke or a vape. Maybe that's
you might have to do that outside, Kate, but we can certainly have a red or your beverage of preference. Absolutely.
Excellent. Well, thanks again. This was Shooting the Breeze with Lady Liberty. Please follow Dr. Joe on X and Dr. Julian Fidge on X as well. They're doing some great work speaking out against the medical establishment, despite the threat of having their licenses cancelled and all the rest that comes with it. So thank you again, and I'll see you next week.
Thank you.